May is Mental Health Awareness Month, a time when advocates urge those who may be struggling to reach out for help.
We've talked a lot about how the coronavirus pandemic has pushed Americans into a mental health crisis. One 2021 study shows the pandemic significantly affected mental health of teen girls. So how can we help? Morning anchor and health reporter Kirstin O'Connor is standing by now to ask a doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
So consequences stemming from the pandemic have been tremendous. We all know that, and disconnection from kids that are in school or friends, changes to routine, of course, isolation partly to blame. So here now to talk about mental health, specifically with teen girls, is Dr. Monica Barreto, a clinical psychologist with Orlando Health. Thank you for being here with us. This is a very important month to highlight mental health, and that's what you're committed to. That's your whole career.
It is. Thank you for having me. This is a really important topic to talk about, bring light to, so we can support both our teen girls as well as parents who are trying to support them as much as they can.
And parents of girls in general. I mean, my daughter is only 15 months old, but it is alarming to hear that girls are being affected disproportionately, at least in the statistics that we're seeing from the pandemic. So what can you say about your conversations with teen girls and maybe where some of that is coming from?
Yes, like we've been talking a lot of, yes, it's impacting boys as well, but we're seeing it a lot more of females tend to internalize a lot of stressors, kind of keeping those things in, maybe not communicating as much, and withdrawing. And especially we're seeing more depression and a lot of anxiety and a lot of avoidance of school and social situations, which is interesting because those were kind of taken away with COVID, and kind of returning to them has been pretty anxiety provoking for a lot of teens.
So when you talk about avoidance, what does that look like to a parent?
Yes, so a good example when we think about what causes the things that make us uncomfortable, nervous, we tend to naturally avoid, like we would a hot stove. We feel the heat, we pull away. Naturally, it's protective. Things that can be avoided a lot by teens are school or social settings or being around peers, things that they're questioning. What if I make a mistake? Worrying about tests. And for a lot of teens, getting caught back up with academics after the pandemic or a lot of kids who have been sick is a big stressor very recently.
And so are they calling out of school, or what are some of the things that parents are telling you and then you're thinking, okay, this may be anxiety?
Yeah, sometimes getting them to school is the hardest thing, getting them to get up. Sometimes this may look like somatic symptoms, which means headaches or stomach aches or feeling really nauseous. Sometimes, it's always important to make sure there's nothing wrong, making sure we see our GI, we see neuro if we're getting headaches, and seeing is this something that anxiety may be playing a part in.
And is it pretty easy to diagnose?
Often I usually get those referrals once they have seen GI or neurology. We're like, the body's looking good, but we're having some trouble with nerves, we're having some trouble getting to school, staying in school. And there the key thing is first letting them know what's happening and why it's happening and helping them get the tools to manage the nerves and getting them back to their day-to-day at school.
Let's say that you're a parent who already knows that your child suffers from some anxiety or depression, and you're trying to navigate these big life events with them. They're going back to school. Maybe they have grad bash, or they have some of these exciting life events coming up, and you don't want them to miss out, but they're feeling that anxiety. What's something you can tell them to help them work through that?
Yes, what I tell parents and teens often, anxiety takes us two ways, either worrying about what has happened or what's worrying about what is going to happen. Helping them regulate their breathing, coming back to right now, this moment, and what can we control? Calming our nerves and problem solving if there is something that they're worried about. My friends aren't going to go, well, let's ask them. Prom's coming. A lot of teens don't want to go by themselves, but are really nervous about bringing the topic up with friends. So helping them bring them back to right now and help them problem solve if they need that support.
And then in worst case scenarios, let's say a teen really is in crisis. What should a parent do to help that teen? What are some warning signs that they need to look out for?
Some big warning signs is some of these patterns. Sometimes the child may be a little bit more nervous before an exam, or nervous because prom is coming or graduation and all eyes are on them. Other times it may be more chronic. They may be missing school 2 to 3 times or missing their first period. Those are all signs that this may be a little bit bigger than just that butterflies in their stomach. And getting them that support, or finding someone, even if somebody in the family they feel more comfortable talking to or talking about this. But if you're starting to see, this isn't my normal child, they're a little bit more withdrawn, probably a little more irritable, those are all signs as well.
All right, lots of good information there during Mental Health Awareness Month. Thank you so much, Dr. Barreto.
Thank you for having me.